For reasons that utterly escape everyone involved, you're listening to A Bipolar, a Schizophrenic, and a Podcast. Here are your hosts, Gabe Howard and Michelle Hammer.
Hey everyone, and thank you for listening to A Bipolar, a Schizophrenic, and a Podcast. My name is Gabe, and I live with bipolar disorder.
Hi, I'm Michelle, and I'm schizophrenic.
And by process of elimination, our producer, Lisa, must be the podcast.
I like that. Good, Lisa.
Today, we are going to talk about money. I feel kind of weird about it because what is it? There's like 3 things that you're not supposed to discuss in civilized conversation: religion, politics, and money. We've already covered religion. Now we're going to talk about money. So politics is coming.
I like money. I'm a big fan of money. I like money.
Of course, we all like money. It's not a question of liking money. Specifically, how does money impact people living with mental illness? And shocker, if you have money, you're going to live better with mental illness.
I would agree with that, Gabe. The more money you have, the better you live with mental illness because you can afford a lot more stuff like therapists, psychiatrists, psych meds. Those are the most expensive things that you need with mental illness, don't you think?
I do. And let's start there for a moment. Let's consider the idea that if Gabe Howard has mental illness and Michelle Hammer has mental illness and then John Doe has mental illness, it's reasonable to assume that all 3 of us would get the same level of care because we're all 3 people living with an illness. So shouldn't we all, and don't we all deserve the same level of treatment?
Deserve, yes, but getting it, absolutely not.
Why do you think that is?
Money, 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 money.
Do you think that the general public is okay with letting mentally ill people suffer just because they don't have health insurance or because they don't have resources or because they don't have money?
I think they must because they see these homeless people all over the place, homeless people with mental illness just hanging out on the street and nobody seems to be helping them.
It's true. The homelessness has skyrocketed since the 80s with deinstitutionalization. And I don't want to fall down any sort of rabbit hole discussing whether or not institutions are good or bad. I'm just saying there's not a lot of help. Bigger cities will have things like peer centers or drop-in centers or consumer-operated services, but even those are woefully underfunded and understaffed and in many cases underutilized. We have the homeless shelters, but they seem to be very much warehousing. They'll keep you out of the cold, but they're not going to treat the underlying condition that led to your homelessness because you don't got enough money.
Exactly. Let me share with you my train story, Gabe. I was living with my roommate at the time, Ben, and he used to catch me talking to myself a lot. And I had this very strange mannerism of I would raise my arms up and down and I would just talk. I'm riding the subway one day and I look down the train and there's a homeless man talking to himself in the exact same mannerisms that I did. And I realized to myself, what is the difference between me and this homeless man? Because we're obviously both schizophrenic. And I realized I have a family, I have friends, and I have a doctor. And if I didn't have those 3 things, I could be homeless just like this man. Kind of made me think right there and made me think that I need to make a change and do something to try to advocate for the mentally ill.
One of the things that I love about that story is the fact that we realize, you realize, I realize, we realize how lucky we are. And I think that a lot of people with mental illness don't realize how lucky they are to have health insurance or family or support or just some sort of intervention. I had money and health insurance and resources, but I didn't have support because my entire family didn't think that I was mentally ill. They thought that I was an asshole. They just thought that I was, frankly, just an asshole. They just thought I was an asshole and that I would somehow grow out of it. And I was lucky. I was lucky that somebody who recognized that I was sick intervened on my behalf. And then, of course, I was lucky that I had, money and health insurance and resources.
Well, something else I wanted to add was that I consider myself lucky as well, also because my mom and everything, they noticed that there was a problem, so they tried to get me help, and I would have never gotten help on my own, so who knows where I would be without that. And I was lucky that when I did go to college and realized there was a problem, the health center with therapists and psychiatrists, it was completely free for me to go. So if I didn't have that opportunity, I don't know where I would be right now.
And it's incredible that it was free. And it's an opportunity that a lot of people don't have in any health space. A lot of people can't get health care at all. Period. Just period. You're sick, tough shit, we don't care. we've sort of made having health insurance in this country like a moral value. And the morals don't end up where you think they're going to. We're no longer in the mode of help the sick. We're in the mode of the sick should have thought about this before they got sick and made goals and gotten health insurance and saved some money and fixed themselves. I don't know how we got there, but even putting all of that aside, even if you've done everything right, you have insurance. You're covered by insurance. There's really not good mental health parity. We love to brag that we have mental health parity. And for those who don't know, mental health parity is defined as treating mental health and physical health exactly the same. We pretend that we have it. There's a lot of advocacy groups across the country who brag that we have it, but in actuality, we don't have it at all. Because you would never hear, oh, you've been diagnosed with cancer? You can see your oncologist 4 times. But all the time we hear, oh, you were diagnosed with bipolar disorder? You can see your therapist 4 times. There's upwards limits. Even in my health insurance, which thanks to my beautiful, beautiful wife is fantastic, I can only see a therapist 26 times a year before they stop paying. So if I'm not well at the end of those 26 visits, tough shit. That's not parity.
So what are you supposed to do then? Then I don't even understand. And also, think about it. What if that therapist you're going to, what if they suck?
Well, some of those visits will be wasted and I have to get a new therapist.
I know people that have gone to psychiatrists that are given to them through different programs, but I know these people and they're not okay. Whatever psychiatrist they're going to is not a good psychiatrist. They're always switching meds, they're trying new things, they're going off things, and they are not well. So that psychiatrist they're going to is just wasting their time and it's not doing good for them.
Let's be fair to psychiatrists and medical providers. We're not saying that they're a bad psychiatrist overall or a bad medical provider overall. We're saying that it's not a good fit. It's not a good fit for that psychiatrist and that patient. And when it comes to the way that mental illness and mental health is treated in this country, treated medically, you have to have that good relationship. Because if you're a person who lives with schizophrenia and you're paranoid and for whatever reason you don't trust your psychiatrist, you're not going to share the correct information. You're going to be fearful and scared and they're not going to be able to get it out of you. I was very lucky. I had a psychiatrist that I was terrified of. He scared the hell out of me. So I just got a new psychiatrist. Do you know how lucky I was? Think about that for a moment. I don't like this guy. I want a new person. Okay. Wow. Just dripping with privilege. Dripping.
At my college, when I was seeing a psychiatrist, there was just the one psychiatrist. So if I didn't like her, there was no other option. I had to only speak to her, and I didn't even know anything about psych meds or anything at that time. So I just did what she told me to do. And that's what I thought was right, and that's what I did.
And that's very problematic because, again, if you don't make that connection, if it's not working, it's not reasonable to think that every single doctor is going to connect with every single patient. And I'm not speaking psychiatry or mental health. Just period. You know, Michelle, you have a gynecologist. If you didn't feel comfortable with your gynecologist, wouldn't you switch gynecologists?
Absolutely.
Because feeling comfortable with, you know, your lady doctor is probably very important to you.
Yes, my lady doctor. I really love that you picked gynecologist, Gabe. You know, not like internist or anything else, but you picked gynecologist, you know? I like that.
One of the reasons that I picked gynecologist is because, one, I just think that is a specialty that you'd probably want to have some comfort. You'd want to be comfortable with your provider. And two, gynecologists are a specialist. A general practitioner, an internist, a nurse practitioner, there's a lot of them. Those are easy to find. Those are a dime a dozen. I'm not insulting any of them, but you and I both know 20 places where we can see an internist or a general practitioner, no problem. But there's less psychiatrists because it's a specialty. And your insurance company will cover less specialists. Some of those specialists, gynecologists, oncologists, psychiatrists, might not be on the list. So even if they're fantastic and you love them, forget it. You can't see them because your insurance won't cover it.
Which is ridiculous. And also there's insurance and covering psych meds as well. I take a lot of psych meds. Insurance covers some of it. If I didn't have insurance covering some of my psych meds, I can't even tell you the astronomical amount of money I would have to pay.
That is an excellent point. I have insurance and I have really good insurance. And my quarterly bill for medication is about $400. That's my copay. My copay is $400. So roughly $133 a month is what I spend on medication. And the insurance company is picking up a large portion of the tab. So could you imagine, let's forget about that insurance company portion. Can you imagine asking somebody who's living on disability, or somebody who can only work part-time, or somebody with very limited resources to come up with an extra $133 a month just for their medication? We haven't talked about copays yet to see the psychiatrist, or copays to see the therapist, or anything like that. We're purely talking medication. That's a lot of money.
That's a lot of money. Yes. You go to the psychiatrist for help. They prescribe you medication for help. You can't afford the money for the psych meds. You can't even be helped. It's just like an ever-going nonsense of, help me. How can I get help if I have no money? It doesn't make any sense. Nobody can get help if you have no money. It's not okay. It's not fair. It makes no sense. Mental health care needs to be free. It needs to be easier to access insurance. Something's got to change, Gabe. I don't even know what to say about it. It's just not cool.
You're a dirty socialist.
I guess so. Call me Bernie.
I am kidding, obviously. I agree that it should be free because a lot of people are impoverished. They don't have the money to do this. And another point that can be made about medications is, let's talk about the newly diagnosed. You're prescribed a medication, you're on it for 2 or 3 weeks, you have a bad reaction to it, and you need to go back to the psychiatrist and get a new medication. Well, that's another copay to see the psychiatrist, and you have to buy the medication again. One of the reasons that I can save money is because I can get the 3-month prescription, and that is cheaper, but it's still a lot of money. And I'd like to point out, I think this is a good pro tip for our audience. I was able to save money by getting on the manufacturer's website and finding one of those discount cards. So one of my medications, my copay would actually be $400 for a 90-day supply. But because I have that discount card, it lowered it to $180 for a 90-day supply. And that's my most expensive medication. The out-of-pocket cost, meaning if I had no insurance, is about $1,200 for a 90-day supply. So if I had no insurance and I needed this medication, I best have $1,200. That's $400 a month. That's a car payment.
Yeah.
That's a car payment with insurance. And maybe a little bit of gas.
You can't always get every single drug that you're on for 90 days because some are controlled substances that don't allow that. So you have to actually go to the doctor every single month to get that new prescription so you can get it for that month because of the whole controlled substance thing.
Right, which is another copay to the psychiatrist. And again, you're not buying in bulk. This is why Sam's Club and Costco are so great. You can get 1,000 pickles for $6.
You know, I've always wanted 1,000 pickles for $6. Thanks, Gabe.
I believe that you have a pickle barrel in your house. I don't know why, but I'm positive it's there.
I think you need to go see your psychiatrist about that.
There's another copay. We'll be right back after we hear from our sponsor.
This episode is sponsored by BetterHelp.com. Secure, convenient, and affordable online counseling. All counselors are licensed, accredited professionals. Anything you share is confidential. Schedule secure video or phone sessions, plus chat and text with your therapist whenever you feel it's needed. A month of online therapy often costs less than a single traditional face-to-face session. Go to BetterHelp.com/Psych Central and experience 7 days of free therapy to see if online counseling is right for you. BetterHelp.com/Psych Central.
And we are back talking about this crazy shit.
We've covered that crisis is expensive. We've covered that health insurance is important. We've covered that it's expensive to be sick. I don't think that anybody is surprised by that, but I think that people are surprised at how expensive it is to be well. We're in recovery. Gabe and Michelle live in recovery. We have a podcast. We have relationships. We live by ourselves. We go on vacation. So people look at us and they think, oh, well, clearly this is not a problem. You're okay. But the maintenance drugs, the maintenance care, because there's no cure for severe and persistent mental illness. There's no cure. No cure. Are you cured, Michelle?
I am not cured. No way, dude.
And I'm not cured from bipolar, and there's no cure for anxiety, major depression. You need maintenance treatment. That's really expensive. And I don't just mean the cost of medication. We already covered that. Let's talk about opportunity cost. Let's talk about how expensive it is to not be able to do the jobs that you're trained for because you need accommodations. And Michelle, you are an excellent example of this because you were hired by New York City graphic design firms. You have a college degree and you are exceptionally talented. You got hired, 8 times at 8 different firms?
Yes, 8 jobs, which I was fired from. Yes, I love that you always love to bring it up, Gabe. But yeah, I was fired from 8 jobs, and it was never because of my design ability. It was always because of symptoms of schizophrenia. I had a huge dream of being an amazing creative director at an agency, but I couldn't do it. I couldn't handle working. So I had to work for myself. Who knows where I'd be right now if I had that amazing creative director job that I've always wanted to have. Maybe I'd be making tons and tons and tons of money like I always thought I would be making. Maybe I'd have that huge apartment that I would always thought I wanted and everything like that. But I'm not, because I couldn't do it.
Michelle, forget about all the pie in the sky, creative executive, master director living in the giant Manhattan apartment. I don't know if you could have gotten there or not. Screw that. Let's talk about the 8 jobs that you got. On day 1, were these full-time jobs that came with health insurance?
Yes.
Yeah, and isn't health insurance something that, I don't know, we discussed is really helpful to people who have, chronic illnesses?
Oh, most definitely, sir.
But your chronic illness prevented you from working full-time at the jobs that offered the benefits that you needed in order to be well.
Yep.
So you had to work on your own, which is, I'm so glad that you were able to reach recovery with schizophrenia and start your own business. But does your business come with free health insurance included in the package?
It does not. I have to get my own health insurance.
So you have to make enough money to not only support yourself, but to also pay for health insurance.
Yep. It's fun.
And pay all the additional costs, the medication, the co-pays. And just out of curiosity, and remember that beautiful wife that I have?
Mm-hmm.
My health insurance is included in my wife's job and is really inexpensive. And your health insurance costs a lot of money that you have to pay for every single month. And which one of us, Michelle, has better health insurance?
You.
With lower co-pays and lower deductibles.
You.
So even though I have more resources, you get less.
Yep.
That's the system.
Mm-hmm.
This is the system that we have created to help sick people in America. Get a job so that you can have health insurance. So if you get sick, you'll be covered. But of course, if you're already sick, nobody's going to hire you because you can't work. So you're going to have to find another way. Now, let's forget about starting a business because not everybody can start a business. But many people living with mental illness, and we know them, they're great people, they can work part-time.
But part-time does not get you health insurance.
But you need health insurance because you're chronically ill.
Hello, government.
Okay, but thankfully there's the safety net. We're so happy there's a safety net. Just get on disability and you'll be fine. Because being on disability comes with really, really great benefits and enough money to live, right?
Disability gets you about 16 grand a year usually. And if you go over 16 grand, you lose your disability.
Wait a minute. So you're saying that disability doesn't cover the expenses to live even meagerly?
Nope. No. If you make more, you'll lose your disability. You live in poverty. You live in poverty or you live in poverty.
But you can get a job and then you can get a part-time job with your disability.
But if you go over 16 grand, you lose your disability. So basically you have to be poor or you have to be poor or you have to be poor. You can't be poor with more money. You have to be poor or poor or poor or poor and poor and poor. When you're on disability, you can usually get on Medicaid that then turns into Medicare. You really utilize that with all of your, psychiatry, therapist, and psych meds.
So you get health insurance to take care of your illness.
Yes, but if you make more money, you'll lose it all.
Wait, hang on. So you're telling me the system is set up so that people get disability and then Medicaid and then are discouraged from working because if they work, they'll lose their health insurance and then get sick and all kinds of bad things will happen to them.
Yes.
And we call this a safety net.
If you are on Medicaid or Medicare and disability and you happen to get married to someone who makes, say, 30 grand a year, let's just say that, but you get married, guess what? your benefits go away. Bye benefits. You now make too much money with your household income.
Because it's tied into their income.
Yes, because you know that I belong to Fountain House. I know people that are partners. The reason why they're partners and not married, because if they got married, they'd both lose their benefits.
So now we're discouraging people from getting married.
It makes no sense. It just doesn't make any sense that disability means you have to stay poor to be on disability. I don't understand the safety net. There is no safety net.
The important thing that society needs to remember is that we're doing our part to care for the mentally ill. And if they're not getting better, it's their own fault for being lazy. That's the takeaway, right? Can we all agree that that's the takeaway?
The safety net is already on the ground. The safety net is too low. The safety net's almost underground, I think. You have to go through the ground to hit the safety net, and then they're like, maybe we should raise it a little bit, and then maybe it's on the grass.
No. The reality is many people who get on disability, they can't get off of it. And the reason that they can't get off of it is not because they're not trying. It's not because they don't want off of it. It's because they can't make enough money fast enough. Because their choices are to either not have a job and have a little bit of money, a little bit of resources, and health insurance, which is just vitally important to people who are living with serious and persistent mental illness. But if they get that part-time job, if they go work at McDonald's, if they go, well, anybody can flip burgers, you're right, anybody can. But the minute they take that job, they make too much money. And the minute they make too much money, remember, part-time jobs, they do not have to give you health insurance. And in fact, they don't. So now the person is making, we'll say $11 an hour. You know what? I'm in a generous mood. They're making $13 an hour, which I don't know these McDonald's that are paying $13 an hour across the country, but let's pretend that they are. They don't have health insurance. And because they don't have health insurance, they can't afford the full cost of medication, of psychiatrists, of case management. They can't afford any of these things. So all of a sudden, their wellness starts to slip because they can't afford it. So before you know it, instead of living in recovery with mental illness, they're just mentally ill. And they have nothing. And they know this going in. So your choice is to live on disability and mind your own business, or to get off of disability and immediately start making $45,000 a year with benefits. I don't know many people that can go from disabled to working full-time with benefits. Most people need a ramp up. They need help. They need support. They need vocational training. And many of these things do not exist for people. We are creating a society of helpless people because we will not give them the resources that they need. Listen, it's expensive to be mentally ill. And we're not providing people with what they need, but we're there standing over them, calling them lazy and telling them that they're not trying.
When my friend was on the phone with disability and they were telling her that she can only make $16,000 a year, and they were asking, how am I supposed to live on this amount of money? The woman on the phone said, I understand. This is why you should call your congressman.
So great. Now, in addition to being sick, we also have to call politicians and argue with them, because everybody knows that people living with mental illness have a lot of clout with politicians.
Yeah. Call the congressman and complain. That's really going to get you far. Yeah, just, okay. And every mentally ill person on disability, yeah, they should all complain and call their congressman. Okay. What? Could you imagine if all the mentally ill people in the world started calling politicians? One, that would be hilarious. But two, they wouldn't give a shit. Yeah, seriously.
Oh my gosh, I figured it out. We just need to hire a lobbyist. I mean, politicians listen to lobbyists. We need a mentally ill lobbyist.
Let's do it.
If only we were a voting bloc.
If only.
Yeah, but people just don't care. People just don't care, and that's why we need more people to speak up. And we need more people to stop saying shit like, oh my God, you're so lazy, just get a part-time job. There are huge barriers that we did not erect in our way.
Not erect.
These are not our fault. We are trying to get over them.
If you've been listening to this podcast, call your congressman.
And say what? Just out of curiosity.
You can just say, hi, congressman. How are you doing today? I think that disability should be raised. You're doing good. If you're doing good. Or don't be a congressman anymore. That's what I think, congressman. Male or female, whoever I'm speaking to. There you go, yo. Peace.
Clearly, I think we need a more refined message. I do not think that Congress people and senators and politicians are aware. I don't think they're aware. I think that they believe that the safety net is sufficient and that it's helping people and that it's saving people, but it's not. It's not. More people are slipping through the cracks than are being helped by the safety net. And this is why we have revolving doors. This is why we have people who are in and out of the hospitals. This is why we have homelessness. This is why we have people getting on disability and never getting off. This is why we have people not living up to their full potential. And this is how come Gabe and Michelle are rare, because we're in recovery. We should not be rare. We should not be rare. We should be the status quo.
I don't understand how people walk all over the city and see these mentally ill homeless people and just walk by and don't see that it's a mental health issue and that it's a money issue and that it could be solved if there would just be free mental health care. I just can't understand that. They just brush them off. Oh, they're just drug addicts and crazy. It could be fixed. It could be fixed, but it's just stigma. Oh, they're homeless and crazy. No. It could be fixed. And people ignore it all the time. And that's what I try to show people. There's people with mental illness living well when they have help. And there's people with mental illness living unwell when they have no help. It's not okay. It's not cool. Things need to change.
If treatment is available, recovery is likely. It really, really is. But so many people can't access basic care. It's shameful. Richest country in the world. We have people sleeping under bridges and dying in the winter.
Absolutely. It's disgusting.
America. Michelle, I don't want to end the show on a hopeless note. New York City is where you live. Didn't you go out on a photo shoot?
Yeah, totally. My friends Cecilia McGow and Joy Irving, we are all schizophrenic, and we did a little photo shoot at the Oculus, which is right near the new World Trade Center. And I posted a little post, and I wrote, "Schizophrenics are taking over the city," and it's just really awesome. I really had a lot of fun.
What kind of reaction did you get? Because you're three attractive young women, and you're wearing clothing that says, "Don't be paranoid, you look great." And, you're making a lot of commotion and noise. Did you gather a crowd?
We gathered kind of a crowd. People thought it was pretty cool. They were asking us about it, and we just told them the whole deal. We live with schizophrenia. We live well. We're trying to change what people think about mental health. It was fun. We had a good time. You'll see more photos soon. Yeah, it was pretty cool.
And you can check out the pictures on your Instagram, which is...
just like the website, schizophrenic.nyc.
Thank you, everybody, for tuning in to this week's episode of A Bipolar, a Schizophrenic, and a Podcast. Maybe next week we will let our producer, Lisa, talk more, but frankly, it's Gabe and Michelle's show. Subscribe to our show on your favorite podcast player and share our episode on social media, or hell, just email it to your mom. Moms love us. We don't know about dads yet. We haven't done the research project. We will see everybody next week.
Call your congressman.
You've been listening to A Bipolar, a Schizophrenic, and a Podcast. If you love this episode, don't keep it to yourself. Head over to iTunes or your preferred podcast app to subscribe, rate, and review. To work with Gabe, go to gabehoward.com. To work with Michelle, go to schizophrenic.nyc. For free mental health resources and online support groups, head over to psychcentral.com. The show's official website is psychcentral.com/BSP. You can email us at show@psychcentral.com. Thank you for listening, and share widely.
Can you pay my bills? Can you pay my telephone bills? Can you pay my automobiles? And maybe we can chill. I don't think you do. So you and me are through. Yeah, Destiny's Child.
Left Eye Lopez changed everything.
That was TLC, dumbass.
Oh. Well, she still changed everything.
She's dead.
Where did Beyonce come from?
Destiny's Child.
She's
way better.
Lemonade.
Becky with the blonde hair.
If you want to gotta put a ring on it, and then you take the ring back while she's sleeping.
You've seen that music video, right?
Okay, did we stop our recordings, people?
Oh, sorry.
No, let's stop. Oh, yeah.
Oh my God, you should delete that other
Okay.
stuff. Yeah, fuck. All right. One,
1, 2, 3.